I recognize the Honourable Leader of the Official Opposition.
Madam Speaker, when challenged by the Auditor General that this government was inappropriately using alternative procurement and not following their own practices, the Premier doubled down, as he did today. But 70% of women and gender-diverse Nova Scotians say they don't feel they're getting the health care they need. This government promised a menopause centre of excellence over a year ago, but has yet to follow through. They refused to even consider a women's health strategy. When are the women of this province going to see the progress that this government likes to talk about?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Speaker. So certainly there's been a number of investments across the healthcare system. The Menopause Centre of Excellence has gone out to RFP. We've been working with experts. I hear all the time. All I've heard for the last 23 days is we don't consult, we don't consult, we don't consult. We've spent intentional time with experts across this province, people with lived experience, trying to consult to make sure that we have the best Menopause Centre of Excellence, and yet that is wrong too. So I'm not actually sure. Spend money, don't spend money, consult, don't consult. Like, I really can't figure it out. But what I can assure you is that we are moving forward with women's health initiatives in this province.
I recognize the Honourable Leader of the Official Opposition.
When my friend called yesterday to see if she was still on the family practice waitlist after 4 years because she was interested in talking about menopause therapy, the person at 811 said, "There's going to be a menopause centre of excellence. You still are on the list. I know it's been 4 years." And she said, "When is it going to open?" And they said, "I don't know." Speaking of promises, the government has campaigned twice on expanding the Cobequid Health Centre. The people of Sackville and the surrounding community are counting on an expanded ER and inpatient services that they need. This is one of the busiest ERs in our province. Last fall, one patient waited 70 hours to be transferred to get care. 2 elections, 5 years in, people are waiting. When will this government keep its promise to the people of Sackville?
I recognize the Honourable Minister of Health and Wellness.
Thank you, Chair. So certainly, as I've said before, we are undertaking extensive central zone planning. Again, back to the point of spend money, don't spend money. We are looking at how we spread and invest our very finite resources into an infinite number of requests. We have learned so much in the last 5 years about healthcare. We are undertaking that. We opened and toured the most beautiful facility that I've seen in a long time at West Bedford. That is part of our expansion. If an individual was at Cobequid for 70 hours, I know that they were cared for by the incredible staff that were there. That if there was not a bed in another hospital, that facility was open and people were caring for individuals, and I trust the system to continue to do that.